What are the key components of informed consent, and how should professionals ensure that consent is valid? Answer: informed consent is a fundamental principle in health and social care, ensuring that service users are fully aware of and agree to the treatment or intervention being proposed. The key components include competence. The service user must have the mental capacity to make the decision. This includes understanding the information provided and the consequences of the decision. Information. Clear, comprehensible information must be given regarding the procedure, risks, benefits, and alternatives. Voluntariness. Consent must be given freely without coercion or undue pressure. Documentation. The consent process should be documented appropriately to provide evidence that informed consent was obtained. Professionals should utilize the Mental Capacity Act 2005 to assess an individual's capacity and ensure that informed consent is obtained in accordance with the General Medical Council (GSC) guidelines. Special attention should be given to vulnerable populations such as children or individuals with cognitive impairments where additional safeguards may be necessary. Explain the legal framework surrounding confidentiality in healthcare. What are the exceptions to this rule? Answer: confidentiality is a core ethical and legal obligation for health and care professionals, governed by various laws, including the General Data Protection Regulation (EDR) and the Data Protection Act 2018. These regulations outline that personal data must be processed lawfully, fairly, and transparently. Key principles include lawfulness, fairness, and transparency. Individuals should be informed about how their data will be used. Purpose limitation. Data should only be collected for specified legitimate purposes. Data minimization. Only the necessary data should be collected. Storage limitation. Data should not be retained longer than necessary. Exceptions to confidentiality arise when risk of harm. There is a risk of serious harm to the individual or others, e.g. safeguarding concerns. Legal requirements. There are legal obligations to disclose information, e.g. court orders. Public interest. Disclosure is necessary to protect the public, e.g. infectious disease outbreaks. Discuss the strategies for maintaining professional boundaries in therapeutic relationships. Answer: maintaining professional boundaries is crucial in therapeutic relationships to prevent boundary violations and ensure the integrity of the professional-client relationship. Key strategies include clear communication. Establishing clear roles and expectations with service users from the outset helps prevent misunderstandings. Awareness of power dynamics. Professionals must be aware of their position of power and avoid exploiting it. Supervision and support. Regular supervision and peer support can provide an opportunity to discuss and reflect on boundary issues. Self-awareness. Professionals should engage in self-reflection to identify any personal feelings or biases that may impact the relationship. According to the Health and Care Professions Council (HCPC) standards, practitioners must maintain appropriate professional boundaries to ensure safe and effective practice. The Code of Ethics also emphasizes the importance of maintaining boundaries to protect service users and uphold the integrity of the profession. Ms. Thompson, a social worker, suspects that a child in her care is being abused. What steps should Ms. Thompson take to address her concerns, considering the legal and ethical frameworks? Answer: in this scenario, Ms. Thompson should follow a systematic approach to safeguarding concerns. Document observations. Ms. Thompson should document her observations, including specific details about the child's behavior, physical signs, and any disclosures made by the child. Consult policies. She should refer to her organization's safeguarding policies and procedures to understand her obligations and the process for reporting concerns. Discuss with a supervisor. Before taking further action, Ms. Thompson should consult with a supervisor or safeguarding lead to discuss her concerns confidentially. This step is critical to ensure support and guidance. Report to authorities. If there is reasonable suspicion of abuse, she must report the concern to the relevant safeguarding authorities, e.g. Local Safeguarding Children Board, immediately following legal obligations outlined in the Children Act 1989 and Working Together to Safeguard Children 2018. Support the child. Throughout the process, Ms. Thompson should continue to provide support to the child, ensuring they feel safe and understood. Analyze the principles of the Data Protection Act 2018 as they relate to healthcare professionals. How should these principles guide the handling of patient information? Answer: the Data Protection Act 2018 aligns with GDPR and establishes principles that healthcare professionals must follow to ensure the responsible handling of personal data. Accountability and compliance. Organizations must demonstrate compliance with data protection principles. Transparency. Patients should be informed about how their data is collected, used, and stored. Accuracy. Data must be accurate and kept up to date. Inaccurate data should be rectified without delay. Storage limitation. Personal data should not be held for longer than necessary. Integrity and confidentiality. Personal data must be processed securely to prevent unauthorized access or loss. Healthcare professionals should implement data protection training and maintain clear policies regarding data handling to ensure compliance with these principles. The Information Commissioner's Office (ICO) provides guidance on best practices for handling patient information. What are the key elements of safeguarding principles in health and social care, and how do they apply to practice? Answer: safeguarding principles are crucial in health and social care to protect individuals from harm and abuse. Key elements include prevention. Proactive measures should be taken to reduce risks and protect vulnerable individuals. Empowerment. Individuals should be supported to make informed decisions about their own care and welfare. Protection. Appropriate action must be taken to safeguard individuals from abuse and neglect. Partnership. Collaborative working with other organizations and agencies enhances safeguarding efforts. Accountability. Professionals must be accountable for their actions and decisions in safeguarding matters. Practitioners should refer to the CARE Act 2014 and local safeguarding policies to guide their practice and ensure the principles are effectively implemented. Describe the importance of empathy and active listening in building therapeutic relationships. How can these techniques be effectively employed? Answer: empathy and active listening are vital components of therapeutic relationships, facilitating trust and understanding between professionals and service users. Empathy, the ability to understand and share the feelings of another. It fosters a sense of validation and support for service users, helping them feel heard and understood. Active listening involves fully concentrating, understanding, responding, and remembering what is being said. Techniques include reflective listening, paraphrasing what the service user has said to confirm understanding, open-ended questions, encouraging service users to express their thoughts and feelings without restriction, nonverbal cues, demonstrating engagement through appropriate eye contact and body language. Professionals should refer to the HCPC standards of conduct, performance, and ethics, which emphasize the importance of these skills in providing high-quality care. What is the role of multi-agency collaboration in safeguarding, and what challenges might arise in this context? Answer: multi-agency collaboration is crucial for effective safeguarding, enabling various organizations to share information and resources to protect vulnerable individuals. The key roles include information sharing. Agencies must share relevant information to create a comprehensive understanding of a case. Coordinated responses. Collaborative efforts ensure that appropriate interventions are implemented in a timely manner. Training and development. Joint training sessions can enhance understanding of each agency's roles and responsibilities. Challenges may include communication barriers. Differences in terminology and practices can hinder effective collaboration. Confidentiality concerns. Professionals must balance the need for information sharing with the legal requirements for confidentiality. Resource limitations. Agencies may face constraints that impact their ability to collaborate effectively. Discuss the implications of boundary violations in professional practice. What strategies can professionals use to avoid such violations? Answer: boundary violations occur when professionals overstep their ethical or professional limits, potentially harming the therapeutic relationship and the service user. Implications include erosion of trust. Boundary violations can damage the trust essential for effective care. Legal consequences. Professionals may face disciplinary action, including loss of licensure or legal repercussions. Emotional impact. Service users may experience emotional harm, leading to further issues in their care. Strategies to avoid boundary violations include regular supervision. Seeking feedback from supervisors can help professionals reflect on their practice. Clear professional roles. Establishing and communicating clear boundaries with service users. Ongoing education, engaging in continuous professional development regarding ethics and boundaries. Mr. Roberts, a physiotherapist, notices that one of his patients has been frequently missing appointments and seems withdrawn during sessions. How should Mr. Roberts approach this situation in a professional and ethical manner? Answer: Mr. Roberts should approach the situation as follows. Assess the situation. Mr. Roberts should reflect on the potential reasons for the patient's behavior, considering both personal and health-related factors. Initiate a conversation. He should approach the patient gently, expressing concern and inviting them to share any issues they may be facing. Using active listening techniques will be crucial here. Explore options. If the patient reveals underlying issues, e.g., personal problems, mental health concerns, Mr. Roberts can discuss possible options for support, including referral to counseling or other services. Maintain professional boundaries. Throughout the discussion, Mr. Roberts must maintain professional boundaries and not delve into personal matters beyond what is appropriate for the therapeutic relationship. Document the interaction. It is essential for Mr. Roberts to document the conversation and any actions taken, adhering to confidentiality and record-keeping regulations. Explain the importance of patient-reported outcomes in the evaluation of clinical effectiveness. Answer: patient-reported outcomes (PROs) are critical in measuring the effectiveness of healthcare interventions from the patient's perspective. They capture information on how patients feel and function, providing insight into their quality of life, symptom burden, and overall satisfaction with care. Relevance to HCPC guidelines. The HCPC emphasizes the importance of registrants understanding and implementing measures that consider patients' perspectives in practice. This aligns with HCPC's standards of conduct, performance, and ethics, which require health and care professionals to ensure that the services they provide are person-centered and responsive to individual needs. Application: using standardized PROs, such as the EC5 or the Patient Health Questionnaire PHQ-9, allows practitioners to assess outcomes quantitatively and qualitatively. Analyzing these outcomes can guide improvements in treatment plans, patient education, and communication strategies, thus enhancing overall care delivery. Discuss the implications of late renewal of registration with the HCPC. Answer: late renewal of registration can have significant implications for a health and care professional when a registrant fails to renew their registration by the deadline set by the ATC. Practice implications: the registrant is no longer legally permitted to practice their profession until their registration is renewed. This can lead to gaps in service delivery and potentially jeopardize patient care. Financial consequences: a late renewal may incur additional fees. Furthermore, if the registration lapses for an extended period, the professional may need to demonstrate continued professional development or retraining to regain their registration. Professional reputation: late renewal may negatively impact a registrant's professional reputation and can raise concerns about their commitment to maintaining professional standards. HCPC guidelines. According to HCPC guidance, registrants are responsible for ensuring their registration is kept up to date and must be proactive in managing their renewal process to avoid these pitfalls. Mr. Thompson, a physiotherapist, has recently received a complaint regarding his practice from a former patient. The complaint alleges that he did not adequately explain the risks associated with a particular treatment. What steps should Mr. Thompson take in response to this complaint? Answer: Mr. Thompson should follow these steps in response to the complaint. Acknowledge the complaint. He should promptly acknowledge receipt of the complaint to the complainant, demonstrating that he takes the matter seriously. Gather information. He should collect all relevant information regarding the treatment provided, including consent forms, treatment plans, and any communications with the patient. This documentation is essential for understanding the context of the complaint. Reflect on practice. Mr. Thompson should reflect on his practice concerning patient consent and risk communication. According to HCPC standards, practitioners must ensure that they communicate effectively, providing patients with all necessary information to make informed choices. Engage with the complaint process. Mr. Thompson should follow the organizational procedures for handling complaints, which may include conducting an internal review and preparing a formal response. Consider reporting. If the complaint is serious and potentially indicative of a breach of the HCPC's standards of conduct, Mr. Thompson may need to report the incident to the HCPC. This is essential if the complaint raises fitness to practice concerns. Learn and improve. Regardless of the complaint's outcome, Mr. Thompson should use this experience as a learning opportunity to enhance his communication practices, particularly regarding risk disclosure. Describe the mechanisms for reporting fitness to practice concerns as outlined by the HCPC. Answer: the HCPC has established clear mechanisms for reporting fitness to practice concerns, which are essential for maintaining public safety and professional integrity. These mechanisms include self-reporting. Registrants are required to self-report any concerns regarding their fitness to practice, such as health issues, criminal convictions, or disciplinary actions from other regulatory bodies. Employer reporting. Employers and colleagues also have a duty to report any concerns about a registrant's fitness to practice. This is particularly crucial if a registrant's behavior poses a risk to patient safety or the public. Public reporting. Patients or members of the public can report concerns directly to the HCPC if they believe a registrant is not fit to practice. This could include instances of malpractice, neglect, or unethical behavior. Investigation process. Upon receiving a report, the HCPC conducts an initial assessment to determine whether the concern warrants a full investigation. If it does, they may initiate a fitness to practice hearing to evaluate the registrant's conduct and competence. What role does quality assurance play in health and care professions, and how does the HCPC contribute to this process? Answer: quality assurance is integral to ensuring high standards of care and professional practice in health and care professions. It encompasses systematic processes that monitor, evaluate, and improve the quality of services provided. The HCPC contributes to QA in several ways. Setting standards. The HCPC establishes standards of proficiency and conduct that all registrants must meet. These standards guide education, practice, and ongoing professional development, ensuring that health and care professionals maintain the requisite skills and knowledge. Regulatory framework. The HCPC monitors compliance with its standards through regular audits, inspections, and fitness to practice investigations. This regulatory oversight helps maintain public confidence in health and care services, encouraging best practices. The HCPC provides guidance and resources to registrants on implementing quality improvement initiatives and adhering to national frameworks, e.g., CQC, NIC, guidelines for quality assurance, feedback and reporting. The HCPC encourages feedback from service users and stakeholders, using this information to inform policy and practice improvements. Mrs. Patel, a speech therapist, is tasked with implementing a quality improvement initiative in her department following a recent performance review. What steps should she take to effectively implement this initiative? Answer: Mrs. Patel should take the following steps to implement a quality improvement initiative. Identify the focus area. Mrs. Patel should analyze the performance review data to identify specific areas needing improvement, such as patient outcomes or service efficiency. Engage stakeholders. She should involve key stakeholders, including colleagues, management, and patients, to gather insights and foster collaboration in the improvement process. Set clear objectives. Establish clear, measurable objectives for the quality improvement initiative, aligning them with HCPC standards and organizational goals. Develop an action plan. Create a detailed action plan outlining the steps needed to achieve the objectives, including timelines, responsibilities, and resources required. Implement the initiative. Execute the action plan while ensuring that all team members are informed and trained on the new processes or practices. Monitor and evaluate. Continuously monitor the initiative's progress using qualitative and quantitative measures. Regular evaluation will help assess the effectiveness of the changes and identify any further adjustments needed. Document outcomes. Document the outcomes of the initiative, including successes and challenges faced. This documentation will be valuable for future reference and for sharing best practices within the organization. Report findings. Finally, Mrs. Patel should report her findings to the relevant stakeholders, showcasing improvements and areas for further development, thereby contributing to a culture of quality assurance within her department. Discuss the significance of the verification and assessment procedures employed by the HCPC in evaluating applicants' fitness to practice. Answer: verification and assessment procedures are crucial in determining applicants' fitness to practice and maintaining public safety within health and care professions. The HCPC employs several key processes. Qualification verification. The HCPC verifies that applicants possess the necessary qualifications and training for their respective professions. This involves cross-checking educational credentials and ensuring that qualifications meet national standards. Fitness to practice assessment. The HCPC assesses applicants' fitness to practice through a comprehensive evaluation of their health, character, and professional conduct. Competence evaluations. The HCPC may require applicants to demonstrate their competence through practical assessments or interviews. These evaluations ensure that registrants are equipped with the required skills and knowledge to deliver safe and effective care. Ongoing monitoring. Once registered, the HCPC continues to monitor registrants' fitness to practice through mechanisms such as continuing professional development (CPD) requirements and fitness to practice investigations. Analyze the importance of implementing quality improvement initiatives in healthcare settings and the role of health professionals in this process. Answer: implementing quality improvement initiatives is essential for enhancing patient care and outcomes in healthcare settings. Key points include enhancing patient safety. Quality improvement initiatives aim to identify and mitigate risks, ensuring safer patient care environments. Health professionals play a critical role in recognizing hazards and implementing protocols to prevent adverse events. Improving clinical outcomes. By focusing on evidence-based practices, quality improvement initiatives can lead to better clinical outcomes. Health professionals are tasked with integrating new guidelines and best practices into their daily routines to optimize patient care, fostering a culture of continuous improvement. Health professionals are essential in promoting a culture of continuous improvement by actively participating in quality assurance processes, contributing to team discussions, and sharing insights on areas for enhancement. Compliance with regulatory standards. Quality improvement initiatives help healthcare organizations meet the regulatory standards set by bodies like the HCPC. Health professionals must stay informed about these standards and ensure their practice aligns with current regulations. Engaging patients. Involving patients in quality improvement efforts helps tailor services to meet their needs, ultimately improving satisfaction and outcomes. Mr. Alford, a radiographer, notices a discrepancy in a colleague's patient reports that could potentially affect patient treatment decisions. What steps should he take to address this issue in accordance with HCPC guidelines? Answer. Mr. Alford should take the following steps to address the discrepancy. Document the discrepancy. He should meticulously document the discrepancy, noting specific details about the reports, including dates, patient identifiers, and the nature of the inconsistencies. Discuss with the colleague. If appropriate, Mr. Alford should have a direct conversation with the colleague involved, expressing his concerns about the reports. This approach allows for clarification and may resolve the issue without further escalation. Report to management. If the discrepancy cannot be resolved directly or poses a risk to patient safety, Mr. Alford should report the issue to his line manager or the designated safeguarding lead within his organization. Following internal reporting procedures is critical in such situations. Consider whistleblowing procedures. If Mr. Alford feels that the issue is not being addressed adequately, he may need to consider whistleblowing procedures in line with HCPC guidance. This involves reporting the concern to an external authority or regulatory body if necessary. Ensure patient safety. Throughout the process, Mr. Alford must prioritize patient safety. He should advocate for immediate corrective actions if the discrepancy could lead to harm or adverse effects on patient care. Reflect on the experience. After the issue is addressed, Mr. Alford should reflect on the experience to identify lessons learned and consider how to prevent similar occurrences in the future, thereby enhancing the quality of practice within his department. Evaluate the techniques for measuring clinical outcomes in healthcare and their implications for practice. Answer. Measuring clinical outcomes is essential for evaluating the effectiveness of healthcare interventions and ensuring quality care. Key techniques include standardized assessment tools. Instruments such as the SF-36 Health Survey or the Barthel Index provide consistent measures of patient health status and functional ability. These tools allow for comparisons across populations and settings, facilitating benchmarking and quality improvement. Patient-reported outcomes measures, PROMs, PROMS enable healthcare providers to understand the patient's perspective on their health, treatment effectiveness, and quality of life. Incorporating PROMS into practice helps tailor interventions to meet individual patient needs. Clinical audits. Systematic reviews of clinical practices against established standards can identify areas for improvement and enhance patient care quality. Health professionals must engage in audits to assess compliance and outcomes. Data analytics. Utilizing electronic health records (EHRs) and data analytics allows for real-time monitoring of clinical outcomes, enabling healthcare providers to track progress and implement timely interventions. Feedback mechanisms. Gathering feedback from patients and colleagues about clinical outcomes promotes a culture of continuous improvement. Health professionals should actively seek feedback to enhance their practice and patient satisfaction. Each of these techniques is aligned with HCPC standards, emphasizing the importance of evidence-based practice and quality improvement in health and care delivery. Regularly measuring clinical outcomes is crucial for maintaining high standards of care and ensuring that health professionals remain accountable for their practice. Discuss the legal rights of service users in the context of the CARE Act 2014. What specific provisions does the Act make to ensure these rights are upheld? Answer. The CARE Act 2014 is pivotal in establishing the legal rights of service users, emphasizing person-centered care. Key provisions include well-being principle. Local authorities must promote the well-being of individuals, considering their physical, mental, and emotional health as well as their social and economic circumstances. Eligibility criteria. The Act sets clear eligibility criteria for care and support, ensuring individuals know whether they qualify for assistance and the nature of that support. Independent advocacy. The Act mandates the provision of independent advocacy for individuals who have substantial difficulty in being involved in care assessments or planning, ensuring that their voice is heard. Personalization of care plans. Service users have the right to personalized care plans tailored to their specific needs and preferences, enabling greater control over their care. These provisions reflect a broader commitment to the rights of service users, supporting their autonomy and participation in care decisions. Analyze the implications of the current mental health strategy on service delivery in community health settings. What challenges might arise from its implementation? Answer: the current mental health strategy aims to improve mental health services, emphasizing early intervention and community-based support. Key implications for service delivery include integration of services. The strategy promotes the integration of mental health services with general health services, facilitating holistic care but requiring significant collaboration and coordination between various health providers. Resource allocation. Implementation may demand increased resources for training staff, developing new programs, and ensuring facilities meet the required standards, leading to budgetary pressures. Stigma reduction. The strategy seeks to reduce stigma associated with mental health issues, which can improve service uptake but necessitates community education and awareness initiatives and access to care. While aiming to improve access, challenges may arise in ensuring that marginalized populations receive equitable care, necessitating targeted outreach efforts. In conclusion, the successful implementation of the mental health strategy hinges on addressing these challenges while aligning resources with policy objectives. Describe effective techniques for managing conflicts in healthcare settings. How can these techniques be applied to improve communication among multidisciplinary teams? Answer: effective conflict management in healthcare settings is crucial for maintaining team cohesion and ensuring patient safety. Key techniques include active listening. Encouraging all parties to express their views fosters an environment of respect and understanding, essential for resolving conflicts. Open communication. Establishing open lines of communication allows team members to voice concerns early, preventing conflicts from escalating. Collaboration. Utilizing collaborative problem-solving techniques helps to engage all team members in finding mutually acceptable solutions, reinforcing teamwork. Cultural competence. Understanding diverse backgrounds and perspectives is vital in healthcare settings, enabling team members to navigate conflicts more effectively. Structured mediation. In cases where conflicts persist, structured mediation can help facilitate a resolution, providing a neutral ground for discussion. By applying these techniques, multidisciplinary teams can enhance their communication, reduce conflict occurrence, and ultimately improve patient outcomes. Mr. Thompson, a social worker, is faced with a dilemma regarding a client, Mrs. Evans, who refuses to consent to a necessary treatment plan for her mental health condition. Despite being informed of the consequences, she remains adamant. What should Mr. Thompson do in this situation, considering ethical guidelines and legislation such as the Mental Health Act? Answer: in this scenario, Mr. Thompson must balance ethical considerations with the legal framework provided by the Mental Health Act. His course of action should include the following steps. Assessment of capacity. Mr. Thompson should assess Mrs. Evans' mental capacity to ensure that her decision-making ability is intact. The Act emphasizes that individuals have the right to make unwise decisions, but capacity must be evaluated comprehensively. Engagement and advocacy. He should engage in open dialogue with Mrs. Evans, exploring her reasons for refusing treatment. Understanding her perspective can help identify her concerns and potential misconceptions. Consulting with professionals. If necessary, Mr. Thompson should consult with other health professionals or an independent advocate to gain further insight and support for Mrs. Evans' situation. Legal and ethical considerations. If Mrs. Evans is deemed unfit to make an informed decision and her condition poses a significant risk to herself or others, Mr. Thompson may consider applying for a treatment order under the Mental Health Act, ensuring that all actions comply with legal stipulations and ethical standards. Evaluate the role of the NHS Constitution in shaping patient expectations and rights within the healthcare system. How does it influence service delivery? Answer: the NHS Constitution is a foundational document that outlines the principles and values of the NHS in England, significantly influencing patient expectations and rights. Key roles include patient rights and responsibilities. The Constitution clearly articulates patients' rights to receive high-quality care, treatment within a maximum waiting time, and the right to complain if standards are not met. This clarity empowers patients to advocate for themselves. Commitment to transparency. By emphasizing transparency in healthcare delivery, the Constitution fosters trust between patients and healthcare providers. Patients can expect to be informed about their care and to have access to their health records. Guidance for providers. The Constitution serves as a guide for healthcare providers, mandating adherence to specific standards of care and service delivery. This alignment ensures that all NHS services maintain a high level of quality, encouraging patient engagement. The Constitution promotes patient engagement in their care decisions, aligning with contemporary approaches that prioritize shared decision-making. Discuss the implications of the Children Act 1989 on safeguarding practices within health and social care. How does this legislation guide professionals in their responsibilities? Answer: the Children Act 1989 provides a framework for safeguarding children and young people, outlining the responsibilities of health and social care professionals. Key implications include duty of care. The Act establishes a duty of care for professionals to protect children from harm, emphasizing the importance of proactive engagement with families and communities to ensure children's welfare. Interagency collaboration. Professionals are encouraged to collaborate across disciplines and sectors to share information and resources effectively, promoting a holistic approach to safeguarding. Child-centered approach. The Act mandates that the child's best interests are paramount in all decision-making processes, requiring professionals to consider the child's voice and views. Legal framework for intervention. The Act provides legal grounds for intervention when necessary, outlining procedures for assessing risk and taking action to protect children from abuse or neglect. Explain the significance of nonverbal communication in healthcare settings. How can healthcare professionals enhance their nonverbal communication skills to improve patient interactions? Answer: nonverbal communication plays a crucial role in healthcare settings, often conveying more than verbal messages. Its significance includes building trust. Positive body language, such as maintaining eye contact and open posture, can foster trust between patients and healthcare professionals, encouraging open dialogue. Understanding emotions. Nonverbal cues, such as facial expressions and gestures, provide insight into a patient's emotional state, helping professionals to tailor their responses appropriately. Cultural sensitivity. Awareness of nonverbal communication varies across cultures. Professionals should strive to understand cultural differences in nonverbal expressions to avoid misinterpretation. To enhance nonverbal communication skills, healthcare professionals can practice self-awareness. Regularly reflecting on their own body language and how it may be perceived can help professionals adjust their nonverbal cues to align with their verbal messages. Seek feedback. Engaging with colleagues or mentors for feedback on nonverbal communication can provide valuable insights into areas for improvement. Training and workshops. Participating in training sessions focused on communication skills can equip professionals with techniques to enhance their nonverbal communication. Ultimately, effective nonverbal communication can significantly improve patient interactions, leading to better outcomes and satisfaction. Analyze a case study of successful policy implementation in healthcare. What factors contributed to the success, and how can these be replicated in other settings? Answer: a notable case study of successful policy implementation is the introduction of the smoke-free in air policy in England. Key factors contributing to its success include strong leadership. Clear leadership from the NHS and local health authorities ensured that the policy was prioritised and implemented consistently across all services. Staff training and support. Comprehensive training for staff provided the necessary knowledge and skills to enforce the policy, alongside support systems to assist staff in managing smoking cessation discussions with patients. Public awareness campaigns. Extensive public awareness campaigns educated patients and the general public about the benefits of a smoke-free environment, generating widespread support for the policy. Monitoring and evaluation. Regular monitoring and evaluation processes allowed for the identification of challenges and the adjustment of strategies as needed, ensuring the policy remained effective over time. Evaluate the impact of the NHS long-term plan on health inequalities. What strategies are proposed to address these inequalities, and what challenges may arise in their implementation? Answer: the NHS long-term plan aims to address health inequalities by implementing various strategies, including targeted interventions. The plan emphasizes the need for targeted interventions in underserved communities, aiming to provide tailored services that meet the specific needs of diverse populations. Improving access. Strategies include increasing access to preventive care and early diagnosis for vulnerable groups, such as those from lower socioeconomic backgrounds or ethnic minorities. Investment in community services. The plan advocates for investment in community health services, recognizing that a community-based approach could effectively address health inequalities by bringing services closer to those in need. Despite these strategies, challenges may arise, including resource limitations. Limited funding and resources may hinder the ability to implement targeted interventions effectively. Resistance to change. There may be resistance from healthcare providers who are accustomed to traditional models of care, complicating the adoption of new approaches. Complexity of health inequalities. Addressing the multifaceted nature of health inequalities requires coordinated efforts across various sectors, necessitating collaboration beyond health services alone. In summary, while the NHS long-term plan proposes comprehensive strategies to combat health inequalities, effective implementation will require overcoming significant challenges. How can healthcare professionals effectively apply the principles of the Equality Act 2010 in their daily practice? Discuss the implications for service delivery and patient care. Answer. Healthcare professionals can effectively apply the principles of the Equality Act 2010 by adhering to the following practices. Understanding protected characteristics. Professionals must be aware of the protected characteristics under the Act: age, disability, gender reassignment, race, religion, sex, sexual orientation, and pregnancy and maternity to ensure equitable treatment for all patients. Promoting inclusive practices. Implementing inclusive practices that cater to diverse patient needs, such as providing materials in different languages and accommodating physical disabilities, reflects adherence to the Act. Training and awareness. Continuous training on equality and diversity helps staff understand their responsibilities under the Act. Fostering a culture of respect and inclusivity, addressing discrimination. Establishing clear protocols for reporting and addressing discrimination within healthcare settings ensures that all patients feel safe and valued, promoting better health outcomes. The implications for service delivery are significant, as adhering to the Equality Act enhances patient trust, satisfaction, and engagement while reducing the risk of discrimination claims against healthcare providers. Ultimately, these practices contribute to a more equitable healthcare system.